Hello, everybody. I hope everyone can hear me. This is Dr. Zolelwa Sifumba. Sorry I'm late. Just been preparing for the live. I think we'll just give it like a few more minutes for people to join, and then we can begin. To start off, hello to the peeps that have joined. Thank you for joining us. Again, this is Dr. Zolelwa Sifumba. So feel free to comment, feel free to ask questions, feel free to, just interact with me as freely as possible. So I think I should begin now. So as I said, my name is Dr. Zolelwa Sifumba, and I am a medical doctor all the way from South Africa. I am a global health advocate as well. I am a part of TB Proof. I'm one of the members of TB Proof, but I used to be part of the board some time ago. TB Proof is really my family. And I will obviously explain a bit more as we continue to talk. Feel free again to ask questions. I am also an occupational survivor of multi-drug resistant tuberculosis. I'll go into a bit more detail just about TB. I mean, this is the TB Proof site, so everyone knows we're talking TB, but I guess I can do a little introduction for those that need one. So as I said, occupational survivor of multi-drug resistant tuberculosis, as well as a survivor of COVID-19, which I also contracted on the front line. So it would be interesting if you guys want to, hear more on, the COVID related stigmas. I'm sure we can talk about that at the end. But here we're about TB. We are going to be talking about TB stigma. So tuberculosis, just for those who, just a quick thing, because maybe people have forgotten because COVID is a thing now. Tuberculosis is an illness caused by Mycobacterium tuberculosum, and is a bacterial illness, and it's basically spread the same way as COVID with respiratory droplets. So people coughing, people speaking, but the droplets are suspended in the air as well. And basically it's known to affect the lungs, but it can affect any other part of the body. I had TB of my lymph node. So we're here talking TB stigma, which I am really excited to be here talking about, because when I had TB, I faced various types of stigma, and as a medical student and obviously as a healthcare worker, I've witnessed a lot of stigma, a lot of stigmatization of people with tuberculosis, and I'm just really excited. I'm a bit emo about this topic because it's quite a tough topic. It's quite close to the heart. So basically, I'll just start off with my own TB journey. Talk about the ties to stigma, and I have a bit of a document here to read to you guys, just talking about stigma to open up the conversation, and then I will bring it back to my own story, and then I'd like to open up to TB survivors, to share their own histories of the stigmas that they faced on their journey, or, people that are currently on TB treatment, even if we have any of them with us. So then I would open it up to everyone else to ask questions. So let us begin. So as I said, I am a survivor of multi-drug resistant tuberculosis. And basically multi-drug resistant tuberculosis is different types of tuberculosis, where there is drug sensitive, and drug-resistant tuberculosis. But that's just to explain, the type of TB that I got. So I got a drug-resistant form of tuberculosis. But essentially, we're talking TB stigma. We're talking all forms of TB. But obviously, I will lean more into my experience of the stigmas that I faced with my drug-resistant tuberculosis. And yeah, sometimes, you can experience them in different forms. And I will talk more about how I feel like TB stigma and drug-resistant TB stigma are different. But anyway, I contracted multi-drug resistant tuberculosis in 2012 as a medical student at the University of Cape Town. That's where I was studying when I contracted the TB. But not to say that this is a problem just at the University of Cape Town, not to say that this is the problem just in the Western Cape. This is a problem all over the world, in fact. Healthcare workers are at increased risk. Healthcare workers and students are at increased risk of contracting TB. So I was a medical student at the time. And yeah, it was tough, first of all, to receive that diagnosis because I didn't perceive myself to be part of, a risk group that could likely contract tuberculosis. But anyway, I contracted it, and it was quite a tough journey altogether. It was hell, to be honest, from the drugs and their side effects, and how hard it made life to live, to, the financial stresses, because I was a medical student at the time and I couldn't continue with medical school while I was sick. So there was those pressures as well. And obviously, internally, I just felt like trash, because I basically couldn't continue with my life. I couldn't do anything, the way it was before. And I just had this illness, and, I didn't know much about it. As much as I was a medical student, we had studied TB, but I think we didn't go into the details of, in fact, you as medical students and health workers are a risk group. Anyway, I faced a lot of stigma along the way, as weird as it sounds, but I will delve into it a bit more after I read, more around stigma and TB. So please bear with me, guys. Cool. Please, if there are any questions, again, you guys can holler. Great. So to end TB, we must end TB stigma. So stigma is frequently described as a process of devaluation whereby stigmatized people are discredited, seen as a disgrace, perceived to have less value or worth, or even seen as a danger. Stigma can prevent people with TB symptoms from being screened for TB and is a barrier for completing TB treatment. Approximately 60% of people living with TB in South Africa also have HIV, which is another highly stigmatized disease. A community rights and gender assessment done in South Africa revealed that the stigma and discrimination is pervasive amongst South African local communities. So there are different types of stigma. And as I read through, I will also share on, my own experiences of such stigma, and I open it up again for people to add in if, they've experienced this kind of stigma, know anybody that's experienced this kind of stigma, anything you want to add. So there are different types of TB stigma. There is a type called internalized or self-stigma. So it captures the idea that individuals may come to endorse negative stereotypes and therefore behave or think according to false portrayals and negative messages. So that is internalized stigma. So that's the person who has the TB having these negative ideas about the TB, and because now they've been diagnosed with it, they stigmatize themselves. So another type of stigma is anticipated stigma. Or perceived stigma. So it is the worry that one will be devalued after a TB diagnosis. For the person with a TB diagnosis, this is the fear, often as a result of observing others being stigmatized, that the stigma against the person will be so bad that will affect access to TB services. It may delay people from seeking and returning for care or impact adherence to the prescribed medicines. Whether or not stigma actually occurs, anticipated stigma may interfere with care seeking and treatment adherence. Another form of stigma is enacted or experienced stigma, and it reflects the range of stigmatizing behaviors, messages, and effects that are either directly experienced by the person with TB or by their families, and or that drive others to acts of discrimination, rejection, or isolation in different settings. Family and community healthcare workplace in particular. Enacted and experienced stigma are two sides of the same coin, either seen from the perspective of the stigmatizer or the stigmatized. Okay, then secondary stigma refers to the idea that caregivers, friends, or family members may expect negative attitudes or rejection because of their association with the disease and or TB patients. Furthermore, this may dictate their behaviors or beliefs regardless of whether stigmatizing attitudes or reactions actually occur. We also have community or public stigma, and it describes the negative attitudes, beliefs, behaviors held by the wider community. So it's the neighbors in particular, or the general public. This is closely related to anticipated stigma. And the last form of stigma that I'm going to tell you all about is structural stigma. And it describes the laws and policies, media and institutional architecture that may be stigmatizing or alternatively protective against stigma. This includes societal level conditions, cultural norms, and institutional practices that constrain the opportunities, resources, and well-being of stigmatized populations. So yeah, sorry about that. It was a long bit, but we can now talk about sort of the forms of stigma that I myself experienced along my TB journey, and the stigma that I faced. It had a huge effect on, how I accessed treatment and how I, completed treatment. So I definitely, the first, form of stigma that I wanted to talk about is internalized or self-stigma. So I definitely suffered from that because I, first and foremost, was not, ultimately, one is at risk of contracting TB by virtue of the fact that they breathe. But somehow the message has been twisted along the lines of that TB belongs to a certain kind of group of people or type of person, and at the time, what I was being taught was the typical, the people that live in a small house with and there's multiple people living in this house, and they're of lower socioeconomic status, and all these negative things around it. So when I was diagnosed, I stigmatized myself. Definitely, I was just like, I don't first of all understand how I got this. I don't, there wasn't a me around who was advocating that as long as you breathe, you can get TB, So I had no idea what I had done wrong. But I felt like I had done something wrong. I felt like I had harmed somebody. I felt like I'd committed some great sin. And it made continuing with treatment every single day difficult. I wanted to quit treatment every single day, with my insight as a medical student and all of that, knowing that, if I default on my treatment, I could get worse, or I could, die, because millions of people are dying globally every year, of tuberculosis, So, yeah. Sorry, I lost my train of thought. But anyway, I stigmatized myself because I didn't understand that, and I was in shock. I was in disbelief for most of, for the first few weeks or months of my diagnosis. I was still in denial, largely, and that obviously affected the way I was taking my treatment. I took my treatment, but it was just very tough because at first I didn't really believe it. I didn't want to believe it because at that time, the stats were saying that only 40% of people that go on to treatment will make it, so that really scared me. So anticipated or perceived stigma, I definitely experienced this because I was stigmatizing myself, I assumed that everybody else, was stigmatizing me. Not to say I wasn't stigmatized against, but I always just would assume, that, and the problem is, I would tell some people about it, and people would be shocked, They'd be like, oh my gosh, so I'd be thinking that, that, oh my gosh, is like, what do you, what do you think is going to happen to me? Like, why are you so shocked? But I definitely felt as though, the people around me did not understand what I was going through. And I did feel as though, some people around me were stigmatizing me based on, the fact that it didn't make sense that one could just breathe and get TB, at that time. And still the common perception is that, you did something wrong, you lived in a bad area, or you took drugs, or you HIV positive, or because even that, is a common misperception. It's not just people, as much as fine, the stats are there that a lot of people that have TB, are HIV positive, but there are a range of other diseases, that leave people at risk of contracting TB, so it's not just HIV. And now there's extra stigma around the two of them because, and actually going into experience stigma, I was stigmatized by the nurses at the very clinic, So basically I came in there and I had been diagnosed with multi-drug resistant tuberculosis, fine. But the assumption for many, people is that people get multi-drug resistant tuberculosis only after they have normal drug sensitive TB and they default treatment. But that isn't the case. There are also people that are being diagnosed with drug sensitive tuberculosis without, having first had drug sensitive TB, So I was basically told by the nurses that I'm HIV positive. And I was told, before they tested me, I was told that I'm HIV positive because only HIV positive people get multi-drug resistant TB, to which I was just like, no, but, obviously I was, scared at the time, so I didn't really speak up for myself. But yeah, it was assumed that I was HIV positive, and it was also assumed that I contracted multi-drug resistant tuberculosis because I defaulted. So I was basically treated badly because they were like, vele wena, you defaulted treatments. And I was like, no, that is not what happened. That is not what happened. And stigma also existed within, the very health system that I was in, because people think that you did something wrong, People think that you did something wrong, and what will enforce people's attitudes towards this is that we are not perceived as healthcare workers. We don't perceive ourselves, and we are not perceived to be at risk of all these illnesses, when in fact we are at increased risk of contracting these illnesses. So there is a culture that, I'm untouchable, and in general in society, and not a lot of people know that TB is still quite a big thing and that it kills millions of people every year, So yeah, I was basically told that, I'm this dirty person. Not to say people with HIV are dirty, like I'm not saying that at all. What I'm saying is that there's this perception of evil and badness, and and it's also attached itself to diseases like HIV. When people aren't, not everybody that contracted HIV contracted it from sexual deviance. There are many other ways people contract HIV, and that says nothing, about their worth, So yeah, and I was talking about in the healthcare centers, a lot of people would kind of ask, like, what was wrong with this doctor, When I joined TB Proof, there were articles, that were published by members of TB Proof, and healthcare workers, some of them were just like, but what was wrong with the doctor? What did she do wrong? And the story is that, they've been a healthcare worker in the health system for this amount of years and nothing's happened to them. So clearly, and it's so bad. Like, there are people that will, assume bad things just based on the fact that, you have this illness. So yeah, and maybe I'll talk a bit now on, it's open to, people commenting if they want to. I guess, not many people on, but I look forward to, the comments that will come after the live. So even after I switch off the live, everyone is welcome to ask as many questions as possible. I really, we really want to get this conversation off the ground around stigma. So the last form of stigma I'll talk about is the structural stigma. And, it exists in many places, and I'm going to speak on it based, from my insight as being a doctor and as being a patient. But for instance, the language around tuberculosis, in healthcare, in the institution, we call people that we think have TB, we call them TB suspects, and that's like, it's crazy, because it's like, why are these people suspects? Like, what is so evil that they've done, And then we go and call people that interrupt treatment, we call them defaulters. Like, it's like, yeah, that defaulter over there, it's like, yo, because calling us defaulters is basically just saying, yeah, you defaulted. But people don't just stop treatment for the sake of it. The treatment itself is quite toxic. The side effects that people experience, and it can make day-to-day life very difficult. So there's a lot of other technical terms in the way we address TB, but I wanted to talk about those things. There's many others, and I'd love for you guys to, I've spoken about different forms of stigma here, and I'd love for you guys to comment and, talk about the forms of stigma that you can see, in society, within yourselves. If you've had TB, I'd like for you to, let us know, how you experienced the stigma, So the stigma for me, very much, and I will close off now, but the stigma for me, was extremely isolating. All the forms, the forms that are sort of outside of myself and the forms inside of myself, so to speak. But it really, and I was also depressed, when I had TB. But the stigma really made it hard to talk to anybody. And eventually I did, find joy in talking to other people that are going through TB treatment and TB survivors, because those are the people that have experienced it, and they know that, they didn't do anything wrong. They were just living their lives and they contracted this illness, so they know that, I did nothing wrong. So immediately they're not treating me like a suspect. They're not treating me like they're treating me like another human being who contracted an illness, So the stigma made me feel very isolated from the world. It made me feel isolated from my friends and my family and the medical community around me, because it was always a question of what I did wrong, And honestly, my whole advocacy career has been around telling people that as long as you breathe, that you're at risk of contracting tuberculosis. And I guess it's an easier message for people to digest now that there is COVID-19 and we can see, that infectious diseases are actually a thing. So as tough as COVID has been, I think it's also come to show people that infectious diseases, really can wipe out millions, within the space of, weeks, a year, and TB is doing the same. TB is doing a lot of damage, possibly even a lot more damage than COVID-19. And COVID-19 has definitely slowed, and it's slowed TB services and people's access to TB care and all of that. COVID-19 really has, and it's crazy because all the things that we needed to be done for TB, the social distancing, the wearing of masks, these things sound familiar, right? COVID. But all those things, if we had the political will to remove tuberculosis, because it's also a pandemic and it's a current pandemic. If we had the political will to, we could have done all of this years ago, and it would be great, to also have a discussion about that. But I largely find that the So I also said that I am a survivor of COVID-19, which I also contracted on the front line. And largely, it feels like there's less stigma around COVID. Yeah, like, it just feels like, I don't know, people are more likely to say that they've got COVID than to say that they've got TB, you know? And that says a lot, you know, about how we as a society, how we as people perceive tuberculosis and how we perceive our risk to tuberculosis. And it also says a lot about the stigma, you know, that people aren't willing to discuss the fact that they have been diagnosed with tuberculosis. And that is quite tough, you know, because tuberculosis is an infectious illness, you know. So I think it's easy to say that the stigma related to TB, as it was said earlier, it prevents people from seeking treatment because they're in denial some of the time. You know, they feel stigmatized some of the time. A lot of the time they are stigmatized, you know. So it's tough to, first of all, go and say, you know, I want to be diagnosed. You know, it's tough to stick to treatment, you know, especially when the people around you don't know, you know, how to support you. And in fact, they don't know your diagnosis, you know, because you haven't told them. So they won't be able to help in ways that are, you know, supportive. So, yeah, I think I'm going to finish off now. Thanks for the people that stuck around. I don't know if any of you have questions or if you want me to speak on something specifically. And I'll just like give it a few little bits. Okay, someone just asked me a question. Doc, were you ever discriminated by peers whom we often assume are more informed than lay people? So, this is a hard question to answer, because you know, as I said earlier, I stigmatized myself as well. So first of all, I did already feel as though, you know, people didn't understand what I was going through. I was afraid of what other people were going to think because I also was like, what is going on? You know, hey Noni. Yeah, so what was I saying? Yeah, so I never actually asked many people, you know, about, you know, how they felt. I didn't ask them directly about, look, are you stigmatizing me? Or, you know, I never had conversations with people, you know, but I definitely, I think I heard around, you know, that, yeah, basically, you know, I lived some kind of deviant life, you know, and I was just like, I don't know about that. I'm just like, guys, we were all in the same hospital together when I contracted this. We eat together, we were in res together, we go out together. So I don't know what is this bad thing, you know, that I did, you know, that makes me so, yeah. But I did feel at the time that a lot of my peers and a lot of the people around me just were avoiding me, you know, and I can't really tell, you know, what the reasons were. But what I do know, you know, is some people were, you know, afraid that I could give them the TB, you know, which is a valid fear. You know, it's a valid fear because we know that TB is an infectious disease. But if people had taken time to inquire, you know, they would have found out that my form of TB was not infectious, you know. So I didn't have TB in my lungs. I had it in my lymph node, you know. So I definitely experienced, you know, people coming around less. You know, I definitely experienced, you know, not being invited to the things, you know, that I used to be invited to, you know. But I don't know how much of that, you know, because it's a push and a pull, you know. I don't know how much of that was, you know, self-stigmatization, you know, me stigmatizing myself and isolating myself, or actually people not coming around. So it was definitely a combination of both. But yeah, I was discriminated against by my peers, and, you know, it is tough because we will often assume, you know, that our peers will have more knowledge. But the thing is, not everybody's clued up about TB also, you know. yeah, we learn about it. Fine, my peers in medical school, we learned about it as an illness, as one of the illnesses that we will be treating, but never was it explained to us that actually, yay, first of all, you can contract this, and second of all, rates of survival are not great, and even if you do survive, there are lasting damages, so not many people know that. Which was why I couldn't expect it of my peers. But yeah, anyway, that's the answer. I don't know if anybody else has a question. Yeah, I've been talking for a while. But yeah, I think I'm gonna close this off then. I hope those of you that joined learned something, and by no means is this the end of the conversation. Very much would love to hear from all the people, survivors of TB, and people that know people that have had TB, people that have lost, family members that have had TB, anyone, everyone. Yeah. We have a question over here. Hi, doctor. You compared TB with COVID. Doc, do you think there's more or less stigmatization for HIV? I think there's more stigma. It seems there's more stigma against TB and HIV than COVID. COVID is something, and they did well with, talking about it and publicizing it and sharing the signs and symptoms and sharing what people need to do if they have it. It's largely normalized because everybody knows about the numbers as well of people dying, So people are a lot more invested, and they can actually see that COVID is something that can affect them. So it's about their perception, to how vulnerable they are to COVID, and, people still have bad views, about, people that are diagnosed with TB, As I said, it's seen as a dirty disease. It's seen as, something like you did something wrong. And HIV too, as much as, a lot has gone into fighting the stigma related to HIV over the years, over the decades, and, since HIV arrived, and, the work of, Treatment Action Campaign and all the other organizations, but they worked a lot, and actually the HIV community worked a lot. It did a lot to remove the stigma associated with HIV. For instance, their shirts of protest saying "I am HIV positive," as a sign, we all it affects all of us. So that was like them trying to, show people that, look, this is all our problem, and it's largely what I've been trying to do, with my own TB advocacy, because I've noticed that there is a gap there. There is a huge gap in the world of TB advocacy, in the TB advocacy space, I guess, we could be doing more, we need to be making more noise, but also there's not much support because people don't think TB is something that can affect them. Literally, like sometimes I'll tell people, I had TB, and they'll be like, oh, that thing still exists. And you're like, yeah, it exists. It's killing millions every year. And people are just like, what? So not a lot has been done to publicize TB and its signs and symptoms and what to do to get help. And it's a curable disease, so there's no reason why there shouldn't be information on it. But yeah, for me, I honestly believe there is more stigma related to HIV and TB. So thank you for the question. If there's any other questions, my lips are dry. We're still here. Any other questions? I think I'm gonna close it up then. Guys, again, please, if you're gonna watch this after, okay. Hi doctor, what is the procedure to diagnose gastrointestinal TB? That's a great question. So I will start off by saying, for those that don't know, TB can affect any part of the body. And it goes everywhere. Everybody knows that it commonly affects the lungs, but it can go everywhere. So I had TB in my lymph node, and you have lots of lymph nodes varying around your body. So people can get pulmonary TB, and people can get extrapulmonary TB, which is TB outside of the lungs. And gastrointestinal TB, or abdominal TB, is TB of the abdomen, gastrointestinal system. So it can be hard to diagnose, but we start off, first of all, with the usual signs of TB. So loss of weight. Obviously, a lot of the symptoms that are publicized about TB are symptoms of respiratory TB, pulmonary TB. So people with gastrointestinal TB can also present with signs of gastrointestinal TB and pulmonary TB. So the person with pulmonary TB is going to be coughing, they're going to be losing weight, they're going to be having night sweats, they can be coughing up blood, various other symptoms. So with gastrointestinal TB, as I said, they could have both, pulmonary and gastrointestinal, but gastrointestinal TB is largely a diagnosis that is made, people have to open, the abdomen to actually see that. And there's lots of different signs that can appear sort of when you open up the abdomen and you obviously do an operation and you see, things like lymph node, you see fluid where there isn't supposed to be fluid. But the people will come with a range of different symptoms, but symptoms directly related to the gastrointestinal system. So some people could come in, with long bouts of diarrhea. Some people could come in with just abdominal pain, bloating, just, I said, abdominal symptoms, nausea, vomiting, but for prolonged periods of time. And some of them will have had, as I said, have it at the same time, pulmonary TB, or have had pulmonary TB before. So they'll come in with the preceding history of signs and symptoms of pulmonary TB. But there are some people that will primarily get gastrointestinal TB, and that's for a range of different reasons. But as I said, TB can go anywhere. So the gastrointestinal system is one of those places. So they'll come in with those abdominal symptoms, as well as maybe loss of weight or night sweats. I mean, it could, be a range of different symptoms. But as I said, the definite, and then we can also do x-rays to check the abdomen. And there's, various signs as well there. But the diagnosis itself, TB, in order for TB to be diagnosed, you need to culture the bacteria. You need to actually find the TB. So there are signs related to abdominal TB that one can see on the various investigations that we do. So like the x-ray, but essentially what needs to be done is tissue needs to be taken, and it needs to be sent to the lab, and tests need to be done to test it for tuberculosis. But some people also test the fluid that is found in the operation as well, if like there no other signs, but it's largely a diagnosis that's made, yes, on the history, but the bacteria itself needs to be cultured, and it can be quite difficult in gastrointestinal TB, and that's why a lot of people sometimes will miss the diagnosis for various reasons. But it's not very clear cut. It's not going to be a, hey, you've got these symptoms, you must have TB abdomen, but there are various other reasons why people could assume. So let's say the person has a history, as I said, of having had pulmonary TB, or they have a TB contact. So somebody in their immediate area at home, or somebody they were exposed to at work or in public transport, someone in their immediate area that is known to have had TB preceding, and then the person, obviously getting gastrointestinal TB. But yeah, it's a tough diagnosis to make because of, the signs aren't usually exactly like, pointing to, okay, this is definitely abdominal TB. The proof needs to be found, needs to be cultured, and it needs to be tested for TB. I hope that answered the question. If there's anybody else who has anything to ask. Yeah, hello to the people that are joining. We are talking TB stigma. Yeah, so any other questions? Yeah, but stigma it's a big issue, man. It really it made me feel really isolated the whole way along the journey. Especially, you know, people around you don't understand. Your peers don't understand. The health workers that are treating you don't understand, because they've never been through it, you know. And I was even in a situation where health workers were irritated with a patient who they were injecting with the injectables through a drip on her arm, you know. And everybody just became very upset, you know, that she kept pulling this strip out. And I, with my experience of having had TB, came and was like, oh, what's wrong? You know, listened to the conversation and heard. And I was just like, you guys are injecting her with something that's so painful. You know, there's no way you can't expect her to cry, you know. So I had various health workers that were along my journey that didn't understand, you know, what it felt like, you know. And there are many others, you know, that, and it's because, you know, I guess not many advocates are speaking out about, you know, the experience of having had TB, you know. And I often say I wish, I mean, and not in a bad way, you know, I often say that I wish health workers can try treatment for a bit, you know, and just come to see that it's not easy, you know. And that's why people, you know, can't call them defaulters. It's not like they're out here committing crimes because they want to, you know. They're not stopping treatment because it's all fun and nice, you know. So yeah, the stigma that I faced really made me want to stop continuing sometimes, you know. And continuing, you know, the stigma that exists structurally, you know, a lot of it hasn't been, you know, pushed down. You know, there's still a lot of stigma, and I guess it's our responsibility to, yeah, speak out and talk about this thing, because TB really can affect anyone and everyone. So really, we should be talking about the stigma related to it, because it does contribute to the losses of lives. I think there's no more questions. I think I'll end it off there. Thanks, guys.